morning. This is our second Friday of the month, ACA Updates for Agents, and I thank you all for joining us. This morning's agenda, we're going to cover a few things here around special enrollment, some legislative updates, the Supreme Court updates, cost controls, some ideas that we might have employers and employees, and those are, you folks that work on the employer group side. Training, we're going to talk about training and some important dates to keep in mind, and then we're going to wrap up with some benchmarking, and again, that's kind of targeted for employer groups. So, all right, let's move forward here. So just as a reminder, I still had some agents with some questions on this. This is in the individual market now. The special enrollment period we're in it right now until the end of April. And it was the caveat, as you guys know, is the people that get special enrollment, I think it was a little bit strange because it was targeting that group of people who were sitting down with their tax preparers and realizing that they owed a penalty for last year for not having health insurance. So once they realized that they really needed to have health insurance, because I don't know where they've been for the last, year and a half, but anyway, they could have a special enrollment period to purchase insurance, and it's just, yeah, because by then they would have missed their opportunity, right, by the time they sat down with their tax preparer. So it just gives them that special enrollment period. If they didn't have coverage, realized they had a penalty, and now they want to buy coverage, they can certainly get it until April 30th for a May 1 effective date, and then, unless there's some other special event that they would qualify for, then they're done for the year. So, and then remember, the fees do go up. So if you talk to folks that still have not secured insurance, their fees are going to be higher in 2015 when they do their taxes in 2016. So I think we're all kind of aware of that. I still can't believe in this day and age people haven't, I mean, I know it's what we do, but people aren't plugged into what's going on here with health insurance. Anyway, so that special enrollment period ends April 30th. Okay, so legislative issues from Washington. Now, I talked about this last month since I'd been out there with underwriters, and they're on a 2-week recess. So I don't know if you have seen some of your representatives or legislators during these last couple weeks, but they've been home on break. And so I just want to remind you of some of the priorities of the things that we are talking with them about from an industry level. The HR 815, which is really, can we take the agent broker commissions out of that MLR calculation? And if you recall, Coventry, I thought this was pretty interesting for them to do this a couple years ago, but they pulled their commissions out of their group products and have that billing services agreement, right? And so they that's how Coventry handled that back then, so that it wouldn't be part of their minimum loss ratio. They pulled it out and had this special arrangement. Well, what we're trying to do at a legislative level is have it pulled out for all carriers. So they would pull our commissions out. It wouldn't be part of the minimum loss ratio calculations, and maybe they'll start squeezing us so bad, right? Of course, the 30-hour work week, both bills have been put forward in both the House and the Senate to move it to 40. It's sitting there right now. My guess is after this recess, it'd be nice to see something done on that. So we'll stay tuned on the 30-hour work week. But these are kind of the talking points if you get in front of any of your folks to mention some of these things. Of course, the health insurance tax. They're estimating that hits a family to the tune of about $500 a year. And then delaying the small group definition. Remember, small group is today 1 to 50, and it's going to 100 in 2016. And we talked last month a lot about what this means. And as you guys know, it means now age-rated rating, if you will, right, for those employer groups all the way to 100 versus having health questions and actually, having a rate based on demographics and health and prior claims and things like that. So it will, we believe, will dramatically change the pricing and, in particular, drive it up. So we're looking to request them to move that small group definition out so that it doesn't go 1 to 100 in small group until either eliminate it completely or until at least push it can down the road, so to speak. And then there's been numerous requests to improve healthcare.gov, and you guys have heard a lot of us. We've been talking about make sure there's a broker portal, make sure there's access for us as the agents and the brokers to go in on behalf of our clients, not only to help them, but to be able to see our business on there, to be able to track our business, which we have no way to do that today. And they're looking at also providing some extra 800, like a 800 service just for agents and brokers so that we can call into a separate place to get help based on who we are and what we do versus going into the general 800 number pool. So anyway, make sure, and we probably missed the opportunity if you haven't seen them yet. I think they're probably back in Washington next week. But anyway, good stuff to keep on point and make sure that you're comfortable with talking about these issues. And we'll keep you posted. So the Supreme Court update, I talked about this last month too, and the only new update I have is, if you guys recall, about a year, probably a year ago since we've met, it's been a while, but we formed a coalition here in Iowa, and I was fortunate enough to be on that coalition with some other folks like representing NAIFA, NAHU, and the Big I. So Bob Scow, Larry Blick, Scott Weiser, those are the three lobbyists and the leads of those three organizations I mentioned. And then they pulled together representatives from each of those three organizations, and I'm fortunate enough to be able to serve on behalf of NAIFA on that coalition. And so with the looming decision of King versus Burwell and whether or not Iowans are going to lose their subsidies and what are we going to do about it, we are going to meet and try to, at least have some kind of a plan that we can go to the governor with and say, if this should happen, here's what we'd like to see happen, or at least give them some ideas. Many of you recall I saw Governor Branstad and Lieutenant Governor Kim Reynolds at the NAIFA meeting, I think it was a couple months ago, and I brought this comment. I just asked them to comment on this what could happen, and thousands of Iowans either losing their health care because they can't afford it, or if they can step up and pay the premium, but so many of them will not be able to afford it, and they'll just their policy. And they didn't. I felt at that time there was no real response from the governor, like let it lie and let the chips fall where they may. And I'm thinking, yikes. We are the ones that are out there face to face with these people, trying to help them figure out how to, pay for their health care. And as you know, the ones, especially some of those early retirees that are on a fixed income and they're not yet 65. So I will keep you guys posted on that we do have a meeting this next week that I'll be a part of, and I'll let you know what we start to come up with in terms of what can we do here in the state of Iowa. So many of us, especially obviously in the group market, in the individual market it's harder, but in the group market we can talk about how do we control costs for our employer groups. And so I want to talk to you about some cost control tactics. And we don't have this first one that I'm aware of here in Iowa yet called reference-based pricing. I've also heard it, and we talked about it at the Health Underwriters Capital Conference back in February, called value-based pricing. It's the same concept. So get this. So it has to do with a couple things. At an employer group level, they're going to set some caps of how much they will pay for certain medical services. And the examples that they give are like a knee or a hip replacement surgery. They're now tend to be very routine surgeries anymore. But we've seen variations from, I'll just use some numbers out there. One as low as a $15,000 knee replacement, for example, to perhaps a $50,000 knee replacement. So how come the variance in some of these procedures that a lot of people are taking advantage of? And so can they employ some kind of pricing cap and or drive employees to certain providers that are willing to put their, number one, put their pricing out there, but also follow up with quality outcomes. So this is really starting to touch more on what we've talked about in the past. We've got to have transparency in the provider marketplace. We've got to see what their prices are, and we've got to see their quality outcomes. Now, many carriers, I'll name Wellmark in particular, have said we're starting to do this already. We've got online tools and resources for you to go and look this information up. So in other webinars and other venues, we'll be bringing forth that information to be able to show to you. If you haven't found it yet yourselves, we'll make sure we're bringing that to you to start to show that kind of transparency so that you can begin to show that to your employer groups and get that all the way down to the employee level who's doing the purchasing. I think that, you know, we've talked about this transparency. Wow, they've opened up the transparency in our world for how much we get paid. We have to disclose that. And I think a lot of us have been somewhat indignant a little bit about the lack of transparency at the provider level. By the way, for those of you in Des Moines, Laura Jackson is speaking at our NAIFA meeting at noon today, and I know many of you can't make it, but I've secured her as a speaker for our NAIFA meeting today at noon. And I'm going to pull her offline and ask her about what she knows about reference-based pricing. And if she knows something about it, then I'm going to ask her if it's okay if I ask the question during her remarks about, you know, to share her thoughts around reference-based or value-based pricing. Because it really, really, the carriers have to help drive this. We can't do it by ourselves, right? So notice that the patients then can choose a provider at the reference price, so they'll know. And if they want to go somewhere else, then they know they'll pay more out of pocket. Now, we also know that this is, I was reading through the regulations through the Affordable Care Act about how this impacts out-of-pocket costs and out-of-pocket maximums. So more to come on that. It's not in our market that I know of yet, but I want you guys to be aware of it so when someone asks you about reference-based pricing, you know what they're talking about. And you can say, yes, we are hearing talk about that in Iowa, and that's why I'm going to start to ask our carriers about it and what are they seeing as a way to hold down prices. So notice that then it puts a little bit of pressure on providers once they see. Can you imagine that provider that's at $50,000 for a single knee replacement, for example, and somebody else is doing it for $15,000 or $20,000? It's going to put pressure on those providers to either show their value, their outcomes better be a lot better, or they need to get more competitive on their pricing. And so anyway, you're going to see this and hear a little bit more about it. Anyway, so I just want to make sure we start to introduce some of these concepts to you as I hear about them and learn about them and find out how we can do some of this cost containment. So let's just talk about some other things around cost control tactics. And some of them we use today. The cost shifting from the employer to the employee. That's a good one, right? Okay, we got a rate increase, but we can't afford to take that on as a business. We're going to go ahead and pass that on to the employee. Or they're going to split the difference with them. And that's a common practice, and that's certainly one cost control tactic for the employer. Another one is looking at partial self-funding. We've seen these companies that have gone to higher deductibles, and then what they'll do, right, is partial self-fund down to a lower deductible and kind of cross their fingers and hope that not everybody is going to blow through their deductible, right? And so some of that taking on a little bit more risk, kind of rolling the dice and hoping that, you know, that it's in their favor. And so that's a common one. We've been seeing that. We're using that. Self-funding is probably, especially down to the smaller numbers, going to be more popular. And what we're finding here, and you guys hopefully have seen it in our webinar series, we'll talk more about what we're doing for training here and how I know you guys are like, holy cow, can I send out one more training invitation? But we really feel right now is the time for us to learn, to capture the training that's out there, because we know when we get into the end of summer is coming, and we know people like to take some time off with their families, but then all of a sudden, before you know it, fall is going to be here, and we're going to be right back into the thick of things. So, but through the Coventry Stable Funding, I believe Monday, this coming Monday, is United Healthcare's All Savers Plans. For those of you, now you have to be appointed to have that, so some of you have gotten a special invite to that. If you're interested, make sure you let Nikita know. So it's kind of, it gets very unique on some of these self-funded products down to the smaller client sizes. And then we've got Wellmark coming on with their products in early May. So be watching for that. But self-funding, as we know, I think is gaining a little bit more momentum. And as the risk corridors can be maintained, and an employer group can look at an option, especially, obviously, if they've got a healthy group. That's obviously key. and it doesn't work for everybody, but it's worth checking out. Another one is, and we've been seeing these, are narrow networks or high-performance networks, as some carriers like to call them, kind of put this positive spin on it. Whether you want to call it an HMO, a narrow network, which is very restrictive to certain provider networks, or these high-performance networks. Those are working. We know that, and it's saving money. So it's not for everybody, but we've got to be having these conversations. And if you just pick out a few of these items and make sure you're talking to your clients about it, you will get stale to them if you keep coming back with, well, let's raise the deductible or let's cost shift. If those are your only two ways to help them control costs, I'm going to guess the employer group's going to get frustrated. So we need to be fresh. We need to come with some new ideas. So the gating. Now, this was an interesting one. I hadn't heard this term, and as I was doing my research for our meeting today, starting with a qualified high-deductible health plan, and you can offer both, but, for example, it's inducing people, if you do these things, I will move you to a richer plan, i.e. like a traditional copay plan. And so that was interesting. So I'm going to drive behavior to where this is the qualified high-deductible health plan, but if you achieve a certain things, we can move you to that richer plan. So it's getting people more engaged in their health care, for example. So I'm sure more to come on that. And feel free, you might see something on here that you're interested in learning more about. Just Google it. Obviously, it's amazing what you can come up with. When I usually lead with the things I'm getting from health underwriters, so I can learn about some of these topics. And then if you want more information, let me know. Or if you think it's worthy, I can certainly will do a deep dive into some of these issues at other monthly webinars. And then reducing subsidies for dependents. Don't forget about this one. I'm still amazed at how many employers are still subsidizing dependents, spouses and dependents on the plan. Now, that's part of their value proposition. God bless them, right? That's awesome. But when they start looking at ways that they can reduce their costs when they're getting rate increases, are we bringing this up at least and talking to them about that, especially now with guaranteed issue in the individual market? How much do you really have to subsidize for the dependents and spouses, and can they get coverage somewhere else? So just being cautious and conscious of the subsidies for those. And then using these a unitized person pricing instead of family rates. We're seeing some people, you know, when you have your family rate, if you're doing those four-way rates, and all of a sudden here you've got, you know, goodness sakes. Now this is, of course, this is composite rating, right? We look at composite rating as one angle. We've talked about that in last month's webinar, I think, and the month before that. But really what they're talking about here is doing away with that $1,200 family rate and starting to show the breakout of a per unit pricing per person. And so more to that, and that's going to be unique. It's going to work for some groups and not for others. So showing, though, the breakout, and that helps them decide they can go shop and get a better price, or they'll go get their own insurance from their own employer. And then, of course, qualified high-deductible health plans as the only option. That will lower, in many cases, it'll lower your premiums, and you're still offering minimum affordability, of course, and the minimum essentials through a HDH plan. And then offering the cost transparency tools, and that's what I was referring to earlier when we were talking about the reference-based pricing or value-based pricing, and looking at some of the tools on how much things do cost. So some of this is education that we think help those employees make better decisions. So a lot of stuff there, just to give you, hopefully, again, pick up a little idea there that you can take to your next group renewal and incorporate that into your conversations. So, as I mentioned earlier, training is now, and this is where we feel really strongly about making sure that you guys have everything that you need, and we're going to, you know, beef the training. Every week, you know, we're doing training now. We do it via webinars. We do it via classroom. We can do it via online, other type of online training, like, you know, training courses, certification. So let's just kind of run through, and this hopefully will help you guys plan your summer as you're looking ahead and saying, okay, you've got kids, and the kids are going to be out of school. and we're going to take a family vacation this year, or with or without kids, right? You're going to take some time off. You know, make sure that I trust that you're going to plan it around some of these things that are coming up. So usually Mondays. Sometimes I've been jumping into a Thursday like we had yesterday, but I'm trying to keep it to Mondays for you guys, as those are typically your days in the office anyway. So Mondays we're doing the webinars. Sometimes we'll even do a morning session like 11 to 12, and then we'll do an afternoon session 1:30 to 2:30, something like that. And then our classroom training coming up, it's the KHI Wellmark sponsored classroom training. Wellmark likes to go out on the road and get face with everybody. It's from 9 to noon is the training. There's 3 continuing ed credits. It's healthcare reform, it's ancillary products, and ethics. Those are the 3, especially if you need that one ethic. Please RSVP. We've sent the notice out. We need to be turning in food counts and all that kind of stuff. We do offer the breakfast snacks and whatnot, and make sure we've got the right room sized for the people that are coming. So if you haven't RSVP yet, please do so for one of the 4 following events, April 21, 22, 28, and 29. And then don't forget the online Wellmark certification. This is their mandatory. If you're going to sell Wellmark any market segment, you will be certified every year. They're going to open that up and do it a little bit earlier this year, so it's not confused with any kind of Medicare training, PPP, and all that kind of stuff. So June 15th to July 15th, you've got to get that done. So if you're going on vacation, I hope you're not taking that whole month off. Okay. Don't forget that our webinars and slides are recorded, and they're on khiagents.com. We are kind of under construction right now on our training tab, so bear with us if you've gone there to try to find one and you haven't seen it yet. We're working on doing some really reorganizing that tab and adding really a training tab, because I want you to be able to go, you know what, I forgot to attend that Coventry individual training. Or Lindsay in our office might tell you, if you call her and go, how do you do a quote for a Coventry individual? Lindsay's going to say, hey, did you catch the webinar that Lynn did? Or excuse me, that Coventry did? And if you didn't, here, why don't you check it out on our website first and then give me a holler back. You see, when it gets down to crunch time later on this fall and you guys want to know something that you don't know, and we've already done training on it, we're going to want to direct you back to our website and ask you to go through that webinar and then call back with questions, because we're not going to have an hour to spend on the phone with an agent when we're in the heat of this, because you guys are calling on, hey, I'm trying to do my certification and I'm stuck, or hey, I'm trying to look up this drug and I'm having trouble. So we want you guys to make sure you're trained as best as you can so that we can be there very, very responsive to answer those very quick questions that are going to come up during the time of year. I'm going to take this opportunity right now. I'm going to escape out of this slide. I'm going to go to our training tab, because I want to show you guys on our calendar what it looks like. So here, for example, is the month of April. When you go out to khiagents.com, you get logged in. And again, if you don't know how to do that, make sure you holler at Nicole so you can make sure you've got it's usually your email address, and actually you can do it yourself. If you forgot your password, there's a click right on there that says reset my password, or I forgot my password. So it's your email address is your login to KHI Agents. Okay, assuming you get in, you'll notice that here in April, this is all the webinars. So you can even look back and say, well, did I miss? Oh, yeah, there was a Coventry Stable Funding presentation on Monday, April 6th, and I missed that one. Oh, here was one from John Nichols, and that was yesterday. But you can just see, and then we've also got on here some of the deadlines to make sure that you know what the deadline is. So we should have right here as well the rest of our, here's some more, our Marketing Mondays. Okay, this is something new we're going to be sending out, just so you know. You want some tips to grow your business? These are going to be the 3rd Monday of every month, and this is going to be all about right over the lunch hour, kind of a lunch and learn idea from 12 to 1 on Mondays. And it's going to be how to help you grow your agency with some marketing tips. So you'll see that on there here on the 20th is our first one we're going to be launching. So our Agent Advisory Council information is on there as well. So please don't hesitate to take a look at what's going on in April and then look ahead to May. I just wanted to make sure you're aware of that. All right. So here are some other important dates that this is coming up now. We have KHI's fall training. We'll back out on the road really to announce what new products have come to market. What about anything going on different with the marketplace? I mean, this is key. How about also those September, October, November, as we start to get into the December and January renewals for our employer groups? So important information then. And then renewals and premium rate changes and all those things happen in September and October. And then don't even forget the Medicare. Sometimes we forget that market, but Medicare sups, whether or not there's rate increases on supplement business. Sometimes that doesn't come out even until November. But as you know, it's just a hotbed starting in September with training, certifications there. The Medicare products, usually certification is opened up. If not earlier, it's usually opened up by September. And then don't forget the new dates for AEP, for the PP Medicare Advantage type products, October 15th to December 7th. And then notice how they've also modified the open enrollment for the under 65 market, November 1 to January 31. So those are critical dates. Make sure you get those on your calendar. And, you know, we've said to our staff, you know, really, really no long vacations, no like family vacations or week-long vacations from October to the end of the year, so that we're there for you guys to answer the phones. They can take a day off here or there, right, as need be, but we really, all hands on deck during this time of year. So the last topic, I think, on our agenda today is benchmarking for employer groups. So apologize if you don't play in the employer group space. I'm telling you, if you don't, I still think you should because, you know, so many people need so much help. And this has been I think the market that has been abandoned because there's been so many agents that have said, I'm out of this business, I'm not going to do it. And so finding those opportunities, they're out there, or agents that aren't staying current like you are by joining conference calls like this. So benchmark is another value add for a KHI agent and their employer group. And you know those employer groups that are very maybe analytical, very into how do I compare with what others are doing like me, either in my marketplace or in my industry or in my size of company. And so we've started a partnership with David P. Lind Benchmark. David used to be a consultant, just like us, just like all of the agents out there, and he had a block of business. Well, about 3 years ago, I think it was, David sold his block of business and went completely into this benchmark concept to be able to provide a consultative type tools to other agents and brokers or employer groups in the marketplace. I sat with David this week to get an update on what he's got going, and he's been doing this for several years, providing this really important information. And it's not just medical benefits. Check it out. It's how much, not only medical benefits and how much maybe an employer contributes, but how about the ancillary benefits, 401k, PTO, or sick time offers? These are all ways that one employer can compare what they're doing to what other employees, what other employers are doing in the marketplace. So we've got this today. So this partnership is, if you work with KHI on all your medical and ancillary carriers, you get a complimentary copy for each group that is 50 plus. It's free to you as a KHI agent. Now notice that I said here, you're going to start to see this year, especially in 2015, KHI's focus is trying to garner all your lines of business, at least your medical lines. So if you choose to go direct to UHC or direct to Coventry because you can, that's okay. You'll pay a reduced rate. So you can get this survey is a $300 retail price. David would sell that to you directly for $300. But in your relationship with KHI, if you have all your medical and ancillary carriers combined with KHI, then we'll give this study to you at no charge, $300 value. If not, we'll get a reduced rate, and you can get it $150. And I have to tell you, that's my cost. David has arranged, because we're promoting him and because of the volume that we'll buy from him, he's reduced that rate. So we think this is really, really cool. And if you're not doing this, this is one more value add that you can provide to your clients that they're probably not getting from one of your competitors, perhaps their agent. And if you do have, this is going to help solidify you with your current employer group. So I can't stress this enough. This is just, again, so full of information. So let me tell you the last and coolest thing here, the new enhancements that are coming on what they're calling Lindex Online. So this is what he was showing me. And I think what I'd like to do, and I mentioned this to David, is we'll do a webinar on this specifically so you can see what these benefits are and decide if this is something that you either want to Okay, I hope I'm back. Oh my goodness. Okay, can somebody go ahead and shoot a text and let me know that I'm back? I was just closing. Luckily, I must have lost my volume or my voice there. Oh my goodness. I'm so sorry. Let's see if I'm back, and if somebody will send me a text or a chat or a question, whatever. Put it in the comment box. Let's see here. Okay, I'm back. Goodness sakes. Oh, that was on my end, you guys. I don't know what happened to my volume. So let me do this. What I was covering, and I see they started coming in about 9:32. Just double check here. Yep, 9:31, 9:32. Okay. So what I was just going. Okay, let's give this a go. Gosh, I'm having a little problem with my phone today, I guess. So I'm trusting I'm back in. So I think what I was just sharing with you guys, let me just back up here on the slide. So as we were talking about the Lindex, and I'll bet that's where I lost you guys. And then I went to our website, and I was looking at all the other value adds. So don't forget about HR solutions. Don't forget about wellness solutions. These are some other things that now's the time to be talking to your employer groups about those kinds of things, right? That we just maybe didn't have time, but talk to them about, are they starting a wellness program, have they thought about it? You know, and that really goes back to cost containment as well. So I'll kind of stop there. I'm trusting you guys can hear me now. Let me scroll down here. There we go. You can hear me again. Okay. So sorry for that. Yep. Okay. All right. So let's go back and see if you've got any other questions. I think I was talking about, maybe when I got cut off, this Lindex Online, about being able to go online and slice and dice the data. And I'll be throwing that to our Agent Advisory Council next Friday to see what their thoughts on it, pricing on it, and then see if we'll bring it out to the masses, so to speak. So I think that's about where I lost you guys. All right, so let's see if there's any other questions. And you can hear me now. So okay. Nobody's got any questions. Comments? How about just any comments? Other than you couldn't hear me. Now you can. Goodness sakes. Okay, checking again for questions. I'll check and see if anybody's raised their hand. Okay. You guys, I'm trusting you still hear me. Paul, I just unmuted you. Can you hear me, Paul?
Yep, I can hear you.
Okay. Okay.
You hear me okay?
Did you have a question or a comment?
No, I'm just trying to get your attention that we lost you.
Thank you. Sorry about that.
No problem.
Okay. I don't see anything other than you lost my connection on questions here, and then I'm back. So let's see. Let's see. Oh, here. Thanks, Scott. Is the governor receptive to looking at a state front to healthcare.gov? If what you mean, I think, is would we have a state-based exchange in order to access that? If that's what you mean, yeah, okay. You know, the governor, a couple years ago when we had this coalition really going hot and heavy before, you know, the states had to commit what kind of exchange they were doing, the governor clarified with both the House and the Senate that he has executive order to be able to make that decision and not drive it to legislation. So there must have been some legislation that was in place that allows the governor executive order to create a state-based exchange. So he's got that authority now. I think he's holding back from doing anything. I think he's open to it, but it's kind of like before. He was not going to lead with a state-based exchange, and I believe from talking to him, it's about the money. Financially, the investment that we've been able to take advantage of the federal government has paid for this federally facilitated marketplace for these last couple years. And if we take on, a state-based exchange, then we're going to be shouldering that expense. And so I think he looks at it from a financial perspective, but he's got to weigh that with the Iowans who are going to possibly lose their subsidies if we lose our subsidies. And we don't even know that that's going to happen, right? So it's just kind of preparing for the what if. So yeah, I mean, I think he is, Scott, but he's always looking at the bottom line. And that's the sense I got last time when we talked about it. And there just wasn't enough incentive in it for him to have a state-based exchange at that time. But yeah, we'll see. We'll see. So no, I'm just glad to represent you all on this coalition, and so I'll know more next week. If it's compelling, I'll send something out soon, but most likely I'll give you an update at next month's healthcare reform conference call. Okay, any other comments or questions? I'm sorry for the technical difficulty this morning. Okay, well, not seeing any, going once, going twice. You guys have a great weekend. If there's anything on here that you'd like to talk more about, Nakia, I've talked with Nakia about, and she's seen the presentation already if she's not on this morning, and feel free to give me a call as well. So have a wonderful weekend, and we'll talk to you guys real soon. Take care. Bye-bye.